racialized beliefs in the medical field?
Yeah, that's a great question. And it's actually one of the reasons that I chose to come to Pritzker School of Medicine. So there's a required course at the beginning of our first year, which I'm in right now, and it's called Healthcare Disparities. And it's an 8-week course. And essentially each week we are touching on concepts of racialized medicine, so like racial injustice and social justice movements, and where medicine sits in the discourse of social justice, concepts of allyship, and how physicians can be allies regardless of their personal held identities, how we can engineer solutions for injustice, and just really the history of medicine. And what I found particularly interesting is the course does a very good job at highlighting the history of the institution as well as something that academic institutions, especially academic medical institutions, don't do as much as really dive into the history of the institutions that they're attached to. And I think that can be harmful in so many ways, because the institution's relation to the communities that they service is not it's not always a symbiosis. It's very much the institution benefiting from it. And so when you're benefiting from something, I think it's very important to understand the institution's privilege and even being situated in these communities. And so if we want to be specific and talk about the University of Chicago, we're situated on the south side of Chicago, where more than 50% of the patient population here are Black and Brown patients from the south side located immediately around the institution. And it's a learning hospital. And so while we are providing services, we are providing care to these patients, there's also millions of dollars of research being conducted using the voices, using the experiences, using the time of these patients who come here to seek care. And so this class, Healthcare Disparities, is very intentional about teaching us about the history of the institution and of the things that the institution has done to craft and really expand into this community. And so I think that it's been a great course. As a future physician, as someone studying in medicine right now, I think that you really do get out of it what you put into it as well, though. And so I imagine that for some, it might not be as impactful, or it might be maybe too impactful, because it's sometimes re-traumatizing to talk about these things every week. But I think that having something like this is incredibly important. I think that it should be instituted at any medical school, because a lot of the times people just simply don't know about the issue. And then you go into the medical field and you start treating patients and you don't even know like what privilege is, or you've never had discourse on that, depending on what your lived environment has been, or you don't know what all the health inequities and what histories have led to those health inequities are. And it's one of the main reasons that I decided to come here, having majored in the history of medicine and understanding these social inequities and how they're rooted in the history. I couldn't see myself going to an institution that did not prize also educating their students on that. And I can't imagine existing in a medical space where so many people will not have received that. And so I'm hoping that that's something that expands to most medical schools amongst the country. Some have decided not to. Some big name medical institutions in the country have decided that it's too controversial to talk about race, and they'll rather focus on just teaching their students medicine, which ignores the notion that the practice of medicine in general is always political from the start. Being able to decide who gets to live and who does not, who gets care and who does not get care, is an incredibly political career or action. And so it baffles me that some institutions are making that move not to include this for their students. So that's where I stand.
And I'm thinking, like, as like you're taking this course, you kind of discuss moments where kind of rehashing experiences that are not as pleasant for some peers versus others who have, like, you know, great experience with healthcare and their physicians and like the system in general. But like, what are moments when like, you were going down this path, whether it be like right now or even in like, you know, back in East Chicago, where it's also not the most diverse experience, even though like where we live in like Hyde Park and in the south side of Chicago is incredibly diverse, and there are more people who maybe reflect the communities of, you know, the voices on this podcast than say the people who actually attend U Chicago. What are moments like you realize that like going to medical school was going to be a different challenge than like your peers who came from different backgrounds, and like different backgrounds being you know, whatever that looks like for you, whatever experience that's been for you, this course or overall?
I really started to realize that in undergrad. So this course, it's about health disparities in medicine. It always becomes about socioeconomic disparities and racial disparities. And so that's kind of what it usually boils down to, because the biggest social determinants of health are very much based on your SES and on usually, you know, racial, which is highly correlated to racial identity in this country. And so I started to really see that when I would be in spaces at U Chicago where it was talking about like race and identity and like discussions and forums on inclusion. And I guess I realized for myself, every time I would go there, I felt like I was taking on a role of a teacher in a way, while for my other classmates, like that was spaces for them to learn, or spaces for them to like make mistakes, or spaces for them to just be quiet or be silent and gain clarity. And I don't think that I ever necessarily had the privilege of just going to see what other people had to say. Even if I had a comment, I felt like it was always what I said was trying to educate. And even if that's not how I necessarily wanted to enter that space, maybe I wanted to enter the space to see where other people were, to see what other people's perspectives were. But I think that the onus gets placed on BIPOC individuals to be that voice, to be the educator in the room, to rehash their trauma or rehash their lived experiences to the benefit of others. And I think that this course, and so I would say that's where I began to feel that in undergrad, and I felt that continuously throughout undergrad in those spaces. But I think that this course diverges from that a little bit more in the fact that it is more of a lecture style course. And so the onus on students is taken off, and it is more of a space where I can genuinely learn and talk through perspectives, and I am learning about other communities as well. And so I don't necessarily feel as much as that way. But what I will say, going into the field and learning more about the field of medicine, one of the biggest pieces of advice that I've been getting from women, particularly Black women who are very well established within the field, is that be careful not to get roped in to diversity and inclusion initiatives. And not that they're saying don't educate, don't give back to community, like don't try to be that. But the reality is, if I wanted to practice academic medicine, and if I wanted to go on the professorship route, I need a certain amount of publications. And what these women have been telling me is that, you know, as soon as you graduate medical school, you're one of probably like 2 or 3 Black people on a service within whatever specialty I choose to go into, and you immediately become one of the first candidates to lead this diversity and inclusion initiative. And of course we say yes. We always say yes, because if we get into this mindset of thinking, well, if not us, then who's going to do it? And then that's perfect for individuals not having to push themselves to also educate themselves and then educate others, non-BIPOC individuals. But they've been saying that, you know, you get these, and it sounds really nice, you're the chair of like 3 initiatives and you feel like you're doing a lot of work, but then when you look at your research, you are 5 steps behind your colleague. The onus has not been put on them. They have not been immediately the first candidates for these positions, although they received the same education you did, although they might have gone through the same health disparities course that you did. That labor that you're doing outside of it to try to educate, you know, the future generations of medicine, and to try to make this field more representative of what you would like to see it be, then takes away from what your career opportunities could be like, what your expectations for what your career and where you would like to be in 10 years. And so I think that that's something that I'm increasingly thinking about as well, and thinking about like where allyship really comes in, and where the lines of allyship, and why, and who is the onus on. I think that that's something that I began to really focus on a lot in my last year of college, like who has to do the teaching and who's expected to do this. And so, yeah, I think that this course does not feel exactly representative, or it's not exactly the same as those earlier conversations where I felt like I had to do teaching, but I definitely see the potential for gaining this knowledge and being Black women in this field, that's one of the expectations going into it. And so I'm just a little wary of what that might look like.
Speaking on college and back to your college career, transitioning into medical life, what advice would you have for other young people, maybe in college, maybe still in high school, who want to pursue this path? What advice or support systems helped you to be the most successful in your pre-med journey? And specifically, what do you wish that you'd known earlier?
I guess one of the things that I wish I would have known earlier was to run my own race. I think one of the best pieces of advice that I got has been run your own race. You lose significant time trying to check where other people are. And I can't, that's an ongoing battle, right? That's an ongoing challenge. That's not something that I just woke up one day and immediately done, but constantly comparing yourself to others while you're on this very, very long journey. I mean, this journey technically starts probably a little bit in high school for some people, and it's at minimum 8 years, including undergrad and medical school. And so throughout that time, if you're constantly comparing yourself to your peers, your classmates, to your friends at different institutions, it can become so emotionally and just mentally draining to do that. And I experienced imposter syndrome, as I imagine many people do, in college. And I think that constantly comparing myself to others just exacerbated that. And so once I began to really run my own race and dig down and realize that I was on a path to medicine for a specific reason, and a valid reason, and one that was near and dear to me. And I realized that my path was my own and that my journey was my own. And once I really started to look at it as a journey and not just a race to hurry up and get through, I gained a lot more clarity, and I began to enjoy the journey a bit more. And so I guess that's one thing that I would say. The last thing I'll say on the soapbox is that your existence in these spaces are radical. Like, for a patient to see you, even if you're just a research assistant, even if you're just an intern rounding with the more senior doctor and you feel like you don't even know anything yet, for patients who grew up on the south side of Chicago or who are now 70 and 80, to see someone that looks like you in these spaces where Black and brown people were even afraid to come during those times because of the racial segregation and redlining that the city had. Like, for someone to see you in that space means everything. And it's so, so important. And so never forget that. And yes.
Symphony Fletcher, y'all. Symphony, thank you so much. Thank you for coming to speak with us. Your words of advice, I think, hit me hard, and I'm not even thinking about going pre-med. That will never happen. But so thank you so much. Thank you for your time, your knowledge, and we wish you the best of luck, starting off your first year of med school here in Chicago.
Thank y'all so much for having me. It's definitely been such a pleasure to be here today, and y'all's questions were so thoughtful. I really, really appreciate the opportunity to come in and speak with y'all, and kudos to you for doing this podcast, and I look forward to future installments.
All right, our guest today is an esteemed woman of color and assistant professor with the University of Chicago's Public Health Sciences Department, a distinguished researcher at the various intersections of health, social inequality, and an individual interested in developing clearer biopsychosocial connections to racially and ethnically charged external stimuli in communities of color, especially the Latinx community. Academically, she has received a PhD in health behavior and health education from the University of Michigan, a master's in community health sciences from UCLA, along with a bachelor's degree in Latin American studies from UCLA. In the current pandemic, on top of the various research she's conducted, the doctor we have on today works to provide guidance and accountability on the advisory board of the COVID Tracking Project, which includes an incredibly thorough, volunteer-powered racial data tracker. She has contributed on news outlets like the Chicago Reporter and in the Race and Capitalism Project's podcast, New Dawn, with the Center for the Study of Race, Politics, and Culture. The Kinda Sorta Brown team would love to give a very warm welcome to Dr. Aresha Martinez-Cardoso.
And sort of diving into the discussion that we really wanted to have regarding your work, how would you describe social determinants of health? And how do social determinants of health create an uneven playing field for health outcomes in marginalized groups, effectively sort of tipping the scales out of their favor?
Yeah, that's a good question. And I think so many people are talking about the social determinants of health outside the field of public health, because so much of it is intersecting with COVID right now. We're kind of seeing them. We see them all the